Okay, good morning. The 72nd anniversary of D-Day, a very significant date in world history, and I had the honor of visiting Normandy after the 2010 election. It's certainly a very moving place. See all those white crosses at Normandy. Anyway, good morning to all of you. Lieutenant Governor Reynolds is out of state attending meetings of the Republican Lieutenant Governors Association, so she's not with us this morning. But today we want to discuss a topic that's been on the forefront of many people's minds lately in an effort to help educate the public. The Zika virus has been in the headlines for several months. And although there's virtually no threat of locally transmitted Zika virus here in Iowa, the Iowa Department of Public Health has been educating the public, local public health partners, and the healthcare community about the virus and its potential impact on travelers to other areas where Zika virus transmission is an ongoing problem, especially that's in Central and South America. We are just about ready to begin the prime mosquito season here in Iowa. And the true mosquito-related concerns for most Iowans this summer is the West Nile virus, which we see cases of West Nile just about every year. There are steps that anyone could and should take to reduce risks related to viruses that are spread by mosquitoes. Not only at Terrace Hill, but we spend some time at Lake Panorama, so we're being close to water, very much aware of the problem with mosquitoes and our grandchildren, and consequently, my family takes precautions to try to prevent mosquito bites and sunburns and things like that. And certainly we're concerned about reducing the spread of this disease. And it's a particular threat for pregnant women that travel to Central or South America. I've asked the Department of Public Health Director, Garrett Claybaugh, and the State Deputy Epidemiologist, Dr. Ann Garvey, to come here this morning to discuss the Zika virus and what Iowans need to know about it. So with that, let me turn it over to Garrett Claybaugh. Garrett?
Governor, thank you very much. Over the last several months, the Department of Public Health has been closely coordinating with our federal partners to better understand the challenges of the evolving science and recommendations around the Zika virus. The department's been communicating recommendations and guidance to public health and healthcare communities throughout the state through presentations, webinars, conference calls, health alert messages, and electronic newsletters. The department is communicating to Iowans through social media and web postings, conveying the risks associated particularly with travel and the recommended protective actions that travelers can take should they be traveling in those areas where risk is highest. We're also reaching out to at-risk populations here who are living in Iowa who travel to those areas of the country, of the world, to provide education and consultation. The department continues to work closely with the State Hygienic Lab as they perform testing for Iowans who are returning to the state from those areas of the world where the virus is being transmitted. Of the nearly 200 Iowans that have been tested for Zika, only 7 cases have been identified, and all of these persons tested and confirmed are individuals who traveled to other countries where transmission is ongoing. We have other more likely diseases, as Governor Branstad mentioned, that Iowans are exposed to from mosquitoes that present a more immediate risk, like the West Nile virus, for example. And Dr. Garvey is here, and we'll talk more about that in a moment. The greatest risk for Zika virus is when Iowans travel to those areas of the world where Zika transmission is ongoing. For example, the Caribbean, Mexico, South America, and Central America. And it's especially important for pregnant women who are traveling to those areas to reconsider their plans or at least take precautions relative to the work that they're doing when traveling in those areas. The department will continue to work with partners at the federal, state, and local levels to protect the health of Iowans, both from disease like Zika that are travel related, as well as diseases like West Nile that can be spread here in the state. To talk more about Zika, I'd like to introduce Dr. Ann Garvey, who's our Deputy State Epidemiologist in the Iowa Department of Public Health. Ann?
Good morning. As Governor Branstad and Director Claybaugh also stated, there's virtually no threat of locally transmitted Zika virus in Iowa. Year for mosquito surveillance has been ongoing in our state, and there's no indication that the types of mosquitoes that are spreading Zika virus in other areas of the world are established here in Iowa. Again, the real risk of Zika virus to Iowans is when they travel to those areas where there is ongoing transmission. Again, those areas are the Caribbean, Mexico, South and Central America. To date, there's been no locally transmitted Zika virus anywhere in the continental US. Approximately 20% of people who are infected with Zika virus will become ill. 80% of people will have no symptoms. The most commonly reported symptoms are fever, rash, joint pain, and conjunctivitis. Illness is usually mild and hospitalization is uncommon. The population that we're most concerned about is pregnant women. Zika virus during pregnancy is a cause of microcephaly and other serious fetal brain defects, including eye defects, hearing loss, and impaired growth. And this is why CDC and the department are recommending that pregnant women do not travel to areas of the world where Zika virus transmission is ongoing. Mosquito transmission is what's really driving the Zika virus outbreaks in these other areas of the world. But there have been some documented cases of sexual transmission. We know that men may be able to transmit the virus to their sexual partner for an extended period of time after they were infected. So if a woman is pregnant and her sexual partner has traveled to a Zika affected area, the public health recommendation is that they abstain from sex or use a condom for the duration of the pregnancy so that the mother does not become infected. If couples are starting to plan pregnancy and either partner has a recent travel history to a Zika impacted area, the couple needs to first consult their healthcare provider to get recommendations on the timing of that pregnancy. Mosquito risk in Iowa this summer is West Nile virus. Iowans are infected with this virus every year, and Iowans need to be taking measures to protect themselves, like wearing insect repellent, such as DEET. This is especially important during those peak mosquito hours, which are from dusk till dawn. Iowans also need to consider wearing long sleeves and pants when the weather permits, and keep those mosquitoes outside by making sure that your window screens and door screens are intact. And you can reduce mosquito breeding sites around the home by dumping out containers that may contain standing water. So again, in closing, Iowans need to be aware of the Zika virus risk when they're traveling to impacted areas. This is especially important for women who are pregnant or who plan to become pregnant. Anticipate that Zika virus will be transmitted in Iowa, but Iowans do need to take actions to protect themselves from West Nile, because we know that our mosquitoes will be transmitting West Nile virus this summer.
Well, thank you very much. And now we would open it for questions on this subject first. You have a question of Dr. Garvey or of Garrett?
Anticipating, are you racing for travel to Rio de Janeiro that you're trying to up the publicity, and are you fear perhaps of Iowans going there and then seeing them bring them back to the state?
We know that Iowans travel to the Caribbean, to Mexico, to South and Central America year round. And so we're really just trying to make sure that they understand those recommendations, again, especially if women are pregnant or planning pregnancy. And so our emphasis has been pretty consistent since we started working on the Zika virus issue. And again, with the timing, we're just wanting to make sure that Iowans realize that West Nile is still a threat here at home, and we need to take measures to protect ourselves while we're here.
Do you anticipate, because of travel to Rio, that potential increased risk of Iowans?
There's a potential, again, anytime Iowans travel to any of these impacted areas, that they may become infected. But again, here in Iowa, we do not have the mosquitoes that are transmitting this virus elsewhere in the country, or excuse me, in the world. And so the risk of importation is always there anytime there's travel.
Other questions?
For the 7 Iowans who have been infected, can you talk about how they all made it through?
Sure. Sure. So of the Iowans who've been infected, There were 4 females and 3 males. None of those females were pregnant. They've all since recovered, and they've all traveled to those areas of the world that we mentioned. And so, again, we haven't had any pregnant Iowans infected with this virus that we're aware of. Everyone is recovered.
Okay.
Is there a Zika virus vaccine at this point, or what is the problem?
Sure. There are discussions. Zika virus vaccine is under development, but as we all know, that takes a long time. And so we don't have any indication of what those timelines may be yet, but there are developmental actions in play.
Okay. If that's all the questions on that subject, we'll open it to other questions on other issues as well this morning.
Last Friday, you said you didn't know about the beds.
Yeah.
Do you now know?
Yes, I do. First of all, this recommendation, this was a PMIC, and when this was opened, there were no other PMIC beds available. There are now 400 more throughout the state, and the recommendation to not fund this first of all, there are no patients there today. The Human Services Council recommended there was not a need to continue this unit, and the legislature did not provide any funding for it. So this was something to be expected, and it's part of the overall change that's going on in the way we deliver mental health. With the mental health redesign, we're providing these services closer to home in more settings. Companies like Four Oaks and Tanager Place do provide these services in cases that they're much closer to home than have to go to Independence to get this service. Other questions?
What do you have to say about the criticism you've been facing in regards to your proclamation that you signed for the Bible?
Well, I'm astounded that people would challenge a governor signing a proclamation to encourage people to pray in all 99 counties. I think virtually every president has in modern history has signed proclamations encouraging prayer. Most governors have done that. I get hundreds of requests for proclamations and for a lot of good causes, and I routinely approve these proclamations. By the way, I've been assured by nonprofit organizations that support religious freedom that if indeed they file a stupid lawsuit, they will defend me. And by the way, all efforts to challenge other governors and presidents that have signed these proclamations have not been successful. Well, the organization, Margaret, you went with me to the luncheon and we heard the, right. Who's the gentleman that put the,
Oh, that would be the gentleman who was with, he writes the book,
right. Okay, but basically, religious freedom is a fundamental part of American heritage. You know, you can go back to the Declaration of Independence and all of the leadership of this country from the very beginning have supported religious freedom. Now, there's a difference between endorsing a specific religion and just encouraging people to pray, which encompasses virtually all religions. So I can't see why anybody would want to object to people having the opportunity to pray. Yes.
But Governor, what about people who identify as atheists? Like, isn't that prevention?
Well, they have their right not to pray, but encouraging others to pray certainly is not a violation of their rights, and it doesn't hurt anybody. I just, for people to think they should be able to impose their views or intolerance on others, we don't need to be intolerant of religion. This country was founded on freedom of religion. That's freedom for everybody. And I'm proud of it. And You know, I sign proclamations for a lot of different things, and this is certainly one that I was honored and pleased to do. And as I travel around the state, I have people tell me that they pray for me all the time, and I just say thank you. I appreciate that, and I think it's important. And I think that regardless of politics, you know, President Obama has signed proclamations encouraging prayer, has attended the National Prayer Breakfast, as have most of his predecessors. I think virtually all the presidents in modern history have done that. Most of the governors have, and whenever those have been challenged, the courts have upheld the presidents and the governors' right to sign proclamations. It doesn't have the effect of law. It's just a statement of support for a good cause.
Governor, you're talking about religion. What do you make about your party's presidential nominee saying that a judge of Mexican descent could not be fair to his court case, and then also a Muslim could not be fair and impartial as a judge?
Well, I guess I disagree with that. First of all, I don't think it's smart ever to comment about a judge that's going to handle a case. I understand he's got a great track record. He's won, I think, more than 10 times the number of cases that he's lost in court. So he's been pretty successful. But I think it's not smart to comment on any judge, especially a judge that's going to handle your case. It's you know, it certainly goes against conventional wisdom. But then again, he has gone against a lot of conventional wisdom.
It's not smart to criticize a judge or to point out his heritage.
Well, both.
Do you think it's appropriate?
No, I wouldn't do it. But, you know, again, I think there's much more important issues facing this country than lawsuits. And Mr. Trump has been quite successful in the court of law. I will give him credit for that. He's had a lot of lawsuits. And as I said, I looked at the USA Today article, and he's won about 11 for every one he's lost. That's a pretty good track record. Just about any lawyer or any individual would be pretty happy to have that kind of a record. I'm not going to get into that. I mean, I guess my feeling is we should be focusing on the substance of the issues. I understand it's 24/7 media, and media just loves to focus on this stuff, but I'm interested in the direction this country's going. $19 trillion national debt. We're now fighting to try to regain Fallujah, which we spent a lot of American lives to get in the first place. We should have never abandoned that situation, and now we're fighting to try to take it back from ISIS. There's a lot of issues and important things that I think we ought to be focusing on.
The governor, as you know, the criticism here isn't a legal or tactical one. It's whether he's essentially being racist.
Well, most people that know Donald Trump know that he's not a racist, and that he's had tremendous relationships with minorities, and he has a lot of minorities and women that have been in key positions in his business. But I really would like to see the focus of the campaign be on the issues that are important to the American people. We just had a report come out that job growth was dismal last month, and that the income of the average American has gone down in relation to inflation. And we need to restore the middle class, and we need to restore America's leadership in the world. And I think he's hit a responsive chord on making America great again. And I think a lot of people don't agree with some of the comments that have been made. But remember, he speaks off the cuff without a teleprompter. That's a lot different than a lot of these politicians that spend their whole life with focus groups and just talking on teleprompters.
I want to go back to the site. So there.
Well, good. I'm glad we're back focusing on state issues.
So was there always a line item for that, or did the legislators provide independents less money than the DHS had recommended?
No, this was a recommendation from the DHS Council. So the group of,
The legislative session.
right, before the session. So their recommendation was that there's not a need to continue to fund this because there's 400 beds in the nonprofit private sector to provide these same services. When this unit was started, whenever it was 27 years ago or something like that, we didn't have those private sector beds. There's nonprofit beds, but we do today. They're closer to home. We believe that they can better provide the service.
So when legislators said you made a unilateral decision.
No, they approved it. This was a recommendation that came from the Human Services Council that then was approved by the legislature. Now, you know, that's the way the process works. I don't need to tell you that. You've watched the legislature for a lot of years, but these things go through subcommittees in the legislature, and then they go through the full appropriations committee. And the fact of the matter is, Human Services is a huge agency. There's a lot of challenges there. And I just want to say, I think Chuck Palmer and the commission have done a good job of managing the change that goes with mental health redesign. And I think we've got a better mental health system today than we had in 2010 because we're going through this change and we're providing better services and we're providing them closer to home. Yes.
Rod had first, and then go back there.
Okay.
You're leaving later for a conference on
The World Bio Conference in San Francisco. Yeah.
How much do you think this chemical production tax credit, I mean, you've got a window here.
Yep.
Is this going to be your opportunity to make your sales pitch and try to bring jobs here?
Well, I went to Montreal last year to tell them that we were proposing it. It passed the House. This year, it passed both the House and the Senate. It's now law, or I guess January 1st it takes effect. But we've already got a number of companies that are looking at it. I think there's a company that Lieutenant Governor just visited in Boone that has already chosen here. Many others, some Iowa companies, others are looking at locating here. Great opportunity to co-locate with ethanol or biodiesel plants. The one in Boone, I think, is making a product that's a byproduct from biodiesel. We think, already you've got the complex at Eddyville where they're making all kinds of products that are byproducts from that. I just think this is the next generation of quality jobs that are going to be able to be created because we have this biochemical tax credit, and I want the world to know it. And this is a great forum to be able to talk about that. And I'll also be calling on some other economic development prospects, some of whom have already invested in Iowa, like McKesson. They're just completing their distribution center in Clear Lake, and some other companies that we'll be calling on there that I can't disclose because we want to wait and let them make the announcement when they're ready to have a facility in Iowa. Yes.
Governor, I know you have to remain officially neutral as head of the state party, but the primary is tomorrow. Which race on the Republican side, which race on the Democratic side are you most interested in seeing results?
Well, they're all important, and I want to encourage a good turnout. There's a congressional races. There's a Senate race on the Democratic side. First of all, I think that Senator Grassley lives a charmed life, and regardless of who his opponent is, I think that he is in a very strong position. And first of all, he hasn't missed a vote in 20 years. He goes to every county every year. I was in D.C. on his birthday, and I know he ran a 10K and beat last year's time on that. So regardless of what happens in the Senate primary, I think that Senator Grassley is in a very good position. Generally, incumbents have an advantage in Iowa, but every now and then, like when I beat Culver, we're able to knock off an incumbent. So time will tell, and I'm not going to take sides. I'm just going to encourage people, I'm going to vote absentee before I leave town today. And I'm just going to encourage people to get out and vote. It's important. And I'll happen to be in California when the California primary results come in tomorrow night. So,
Yes, you about voter turnout, Governor. It was huge during the caucuses.
yep.
Would you be surprised if we didn't see a big turnout, or do you think some people are just kind of over it?
Well, it's a good question. Generally, I've been involved in probably the biggest caucus, the biggest primary elections. I think 1994 when I beat Fred Grandy, was the biggest Republican primary turnout in history. 2010, we had a fairly good-sized one then. I don't know how this one's going to be. I don't think it's going to be a record setter like our caucus turnout was, but hopefully there will be enough interest and participation that we'll have a good turnout and I certainly want to encourage everyone to vote, and frankly, you've got to, if you're a registered Republican or a registered Democrat, you can vote in your primary. Even if you're not, you can change party registration or as an independent choose a party to vote in the caucuses. You can do that on election day. So there's no excuse for not participating.
Thank you, Governor.
Guys, I was just getting warmed up. Thank you.